Hello. Please wait to mute yourself. Who are opening their mic, please mute yourself. Hello, I am Dr. Rifat. Today, I am here for you to start a orientation session regarding MRCS Part B OSCE exam. Recently, some of our candidates who appeared in different areas of surrounding countries, and we have noticed that after having a very good exam and a very good preparation, many candidates have been failed in the exam. That's why, on request, on every some of my senior colleagues and junior colleagues, brothers and sisters, requested me as I have achieved some smart mark in different both of the sections like knowledge and skill. They asked me how to start, and they have prepared themselves very smartly and very for a very long period of time. They also gave their exam well, but they couldn't make their self pass. So what's the difference? Or what have I have done and what they didn't do? That's why they have failed and I have passed. So I think MRCS Part B exam is not an exam of knowledge. It's all about skill and skill and practice and practice, but practice under supervision of some mentors or some seniors or who have passed in the exam. Because I have seen so many friends or so many colleagues in my life, even my reading partner, and also some of my seniors and juniors. I have seen so many people. They prepared themselves for 6, 7, 8 years, 8 months, or 1 year also, and from day to night, whole day, and they have put their job, their practice, everything, but they couldn't make themselves pass. So what's the difference? What really happened in the exam? So, but I have also noticed, and you all of you know that, especially the junior doctors who just have completed their internship 6 months back, or 1 year back, or 2 years, 1.5 years back. Within 1.5 years, they have completed their MRCS Part B OSCE exam. So what's the difference? I have seen so many my senior colleagues who have completed their FCBS exam, one of the toughest exam. I think one of the toughest exam, not only for Bangladesh, also from the whole world. They also failed in the MRCS Part B exam, so with a very poor mark. So what really happens? I think I have already mentioned that this is not an exam of knowledge. It's all about skill, and in though we have some knowledge stations, but also we have some skills portion in the knowledge. And maximum doctors who are appearing in the exam, they don't know what where the about the mark distribution, what they have had to do in the exam, what the mark distribution, and how to approach, how to answer the questions. This thing really matters in the MRCS Part B exam. So I am Dr. Nahid Hassan Rifat. Before you, almost all of you, my known person, senior, junior, and my friends. I'm working in BSU as a medical officer in the Department of Urology, and I have been teaching in FCPS residency and some of the faculties in some institutes for a long period of time. So shall we proceed? So at first, our topic is let's crack MRCS OSCE. So at first, you'll have to know about the total station. What are the stations in your exam? Just remember, there are total 17 stations you will have to perform. 70 stations you will have to perform. And there are 2 preparatory stations regarding the communication in person, communication in person, in phone call. I'm prepared to discuss all about today, and it will take almost more than 1.5 hours. So just I will break everything one by one. So I think I should discuss all about every single stem, every single station, what we'll have to do, what we'll have to not to do, what the mark distribution, why people really fail in the exam after having a very good preparation. So total there are 70 stations. These stations are for performing. You will have to face examiner 70 stations. There's two preparatory stations. The one is person, communication person, and another one is phone call. And there are some rest stations. So rest stations really depends on the centers to accommodate the more examining in one center. Like there are seven doctors or seven candidates in the station, but you have five performing stations. So total seven candidates, and five performing stations. So the center, what the center really do, they accommodate seven stations in a row, like this: one, two, three, 4, 5, 6, and 7 stations in a row. So they gave one or two rest stations, like this one is rest stations and this one is rest stations. So they can accommodate 7 candidates: 1, 2, 3, 4, 5, 6, 6, 7. So when they rotate along the stations, they after having 7 stations, the candidate can be finish their exam. So these are the rest stations, nothing else. So total performance stations, there are 17 performance stations. To rest preparatory stations, I will discuss about this later on. And rest stations depends on the centers, especially in those centers who accommodate their center with a very large amount of candidate. They usually give more rest stations, and especially in the UK centers, they give more rest stations. So total performing stations 17, and among the 17 stations, you will have to face 8 knowledge stations. Total knowledge stations 8, and total 9 stations is from skill. So are you clear about the stations? Everyone, are you clear about the stations?
Yes.
Okay, fine. Then time distribution for knowledge part. So as I have already mentioned that there are 8 knowledge stations. So every single station comprises 20 minutes. Sorry, 10 minutes. Every single 10 minutes. So in case of knowledge stations, how the exam really goes on. At first, this is a house. This is a room. I think this is a room, and this is a table inside the room. Inside the room, this is a table, and this is the examiner. He will sit down here. So at first, 10 minutes is divided into 1 and 9 minutes. This one is 1 minute, and this one is 9 minutes. So at first, you will get 1 minute at the door. There will be question paper which will be hang in the inside in front of the door, and will stand up. This is you, and this is the question paper. So for the first 1 minute, you'll have to have the time for the read out the question. Then the bell again ring, and you will enter into the room, and there is a chair here, and you will have to sit down here. And examiner will start to ask the questions for the next 9 minutes. So knowledge stations are divided like this, and all the knowledge stations are like this. There is no difference regarding anatomy, pathology, or critical care. No one. Just they arrange the exam like this way. So we'll have 1 minute at the door, and after entering the room, you'll get 9 minutes to answer all the stations. Right? I will discuss about everything later on. So 1 minute for the read out the question, and 9 minutes for right? Okay. So now come to the mark distribution. So total there are eight stations, and every single station comprises 20 marks. So total 160 marks in knowledge portion. Knowledge portion you will have to face for or fight for 160 marks, and the mark pass mark depends on. So pass mark usually I have seen for the last 1.5 years that pass mark really depends on the stations, and day by day every single pass mark really if an exam is going on for long 4 days in a station, pass marks varies for the every single day, because all the examiners are appearing in the on a single day exam. So they by some law modified Goff method or something like this, they percentile the pass mark. And I have seen whatever the pass mark is, the pass mark varies always 106 to 112 maximum 112 and minimum 106. So you'll have to have gain, or you have to focus your knowledge portion. You'll have to have more than 112, I think, is the safest mark. So if you get 112, I think you will pass in any center, or whatever the pass mark is. Don't worry, just if you get more than 112, you will pass, inshallah. Are you clear about the pass mark regarding the knowledge portion?
Yes, Bhaiya.
Okay, that's good. Now come to the station distributions regarding the knowledge. There are three stations. You will have to face three type of stations. At first, you will have to face anatomy, then critical care, and then pathology. Three type of stations. Now come to the anatomy stations. Let's break anatomy stations. Okay. At first, you will get three anatomy stations, and maximum doctors who are appearing in the MRCS Part B exam just go through the anatomy. They just go through the whatever the topic is, like abdomen or lower limb, upper limb, and whatever the topic is. But they really don't know how the anatomy questions are distributed. Just note it down. There are so many topics regarding anatomy. So what are this? One is brain plus head neck, upper limb, lower limb, then spine, thorax, and abdomen. So just this time, I request everyone of you, just remember, don't forget this, because the anatomy is the trump card. And if you want to pass in the exam, that will have to have very focus regarding the anatomy, because the station, if you practice very properly in anatomy portion, that will bring a huge amount of mark. So the anatomy, these are the topic regarding the anatomy. And one question will always, you will find one question always from this portion, one station. You will get one station from brain and head neck. Definitely just go through the previous stations, all the previous mock, and you will get definitely one station from head neck. So you'll have to have very much prepared regarding the head neck. Don't ever dare to forget that head neck. I will practice head neck later on or something else. Just never, because if you ignore the head neck portion, because MRCS, I don't know why it is very famous in MRCS, like in part 1 or MRCS part A or part B, but they always love to ask you from the head neck nervous system, something else. So second question, you will always get another question from the upper or lower limb. And you also know the limbs are very important. I always like to say MRCS Part B exam, not only Part B exam, especially Part 1 also in some kind, but especially Part B exam is not the exam for the surgeons, it's the exam for the orthopedician. Always remember, because in every aspect of the exam, you will get so many questions from the orthopedics portion. So the orthopedic candidates who are my dear brothers, colleagues, friends, just have faith that you will get you will be favored in every stations, because you will get so many familiar questions. You will have to focus every day. So there is another one station from the upper and lower limb, and one station from the spine, thorax, and abdomen. Right? These are the three questions. So how the anatomy stations are arranged in the exam. Like, again, come to the another station. This is an station, and this is the question paper, and this is you. I am extremely sorry, you are drawing very badly. And this is a table, and this is the examiner, and this is the wall. So this is the wall. So in the wall, there are so many questions or pictures like this one. There are so many questions or pictures like this one. So at first, you'll get 1 minute to read out the question. At first the bell will ring and you will have to read the question. Like there's nothing written on the question, like the just 2 to 3 lines there might be written like this. So there's a 60 years old male came to you with a road traffic accident, and he injured his knee from the posterior aspect, and regarding the case, just identify the structures and face the questions inside the station, like this. So just 2 to 3 minutes, 2 to 3 lines. So after 1 minute we'll enter into the room. So what examiner will do basically, the examiner will stand up and will bring you to the wall, and examiner will start to ask you this question. Dr. Kaushik, are you there, my friend? Dr. Kaushik.
Yeah, Dr.
So,
Deepak. Yeah.
so like this is a room, this is a room, this is a room.
Yes.
So the examiner bring you here and will start to bring you. Okay, doctor, could you tell me which the structure is? Which the structure is? Can you answer me, doctor? Okay, this is a semi-membranous, right? So I think you will
Yeah.
have semi-membranous. So the examiner will start to ask you. So where does it insert? Can you tell me? Okay, what is the nerve supply, doctor? What is the function of this muscle? So then he will again ask you whenever you will finish to answer everything. Then he will start to ask you what is the structure? What is number C? Sometimes he will ask you the what is the number C. So you will look for the number C and you won't find where it is at. So then he will indicate it like this is the C. So you will have to answer the question and answer the question, and after you give the question, answer the question perfectly, and then he will ask you what is the nerve supply of the long head of biceps femoris. So what is the number D? Like this is the vastus lataris, right? So where does it starts? What the function of the vastus lataris? So always remember, the examiner won't ask you about any muscle what is not in the question paper. Always he will at first he will ask about the identification. At first he will ask you some identification, then in some cases insertion. Origin is less commonly asked. Especially nerve supply is very important. Nerve supply, whenever the examiner will ask you regarding a muscle, he will always definitely note it down. He will always ask you a nerve supply. Definitely never ever forget or dare to forget that about the nerve supply, because he will ask you definitely nerve supply, and if the nerve is injured, what will happen, and function of the muscle, everything. These 5 things will always examiner will ask you inside the room. At first, identification, sometimes insertion, or the function, nerve supply, and if the muscle is injured, and if any clinical question is related on other than nerve supply, then the examiner may ask you, right? In case of thorax, there is some esophagus. So examiner will ask you what is the nerve supply or the lymphatic drainage, lower portion of the esophagus, what is the echinacea cardia. They also ask you, they may ask you, because esophagus is related to some clinical questions like echinacea cardia. So they might ask you what is echinacea cardia in the anatomy section. So always remember, always try to remember the clinical questions will be asked you regarding the structure, identification, nerve supply, blood supply, everything, this kind of question. So what really happens in our exam? Just remember the pictures that are given in our conventional books. Maximum picture in the exam you won't get from the book. Just note it down very properly. I'm again saying the questions that are given in our conventional books, you won't get any questions, any pictures. Maximum time you won't get any pictures from those books. So how people pass, how people get so many marks, like 60 marks from the anatomy. So how people really get so many marks in anatomy portion. So I would suggest, whenever you go any book, any demonstration book or any atlas, just try to remember, try to memorize, try to correlate what the structures. I am sharing one of my senior colleagues experience, and he knows everything. whenever he just go through the conventional books, what are the pictures, if you just his condition was like that, if you ask the my senior colleagues, bhaiya, just tell me the what is the picture is page number 23, you will be able to say, even with the letters, like what is written on the letter J, what is the structure regarding letter I, everything on the books. But whenever I have asked some questions, some pictures like this way from Macmeans or some Jeremy's and some, so other books that I used to follow, whenever I ask him what is structure, they can just he couldn't answer anything. So he did very bad in the exam, and unfortunately he couldn't pass. It's a bad luck. But you will have to have a very proper clinical conception, very proper clinical knowledge regarding the anatomy. So just this is a proper, this very good picture. I think this whenever you will you will see that this picture, you will be able to every question regarding this one. But the questions that will be given in your exam are really bad, really bad. All the cadaveric pictures are really bad. Some pictures are laminating, and sometimes the examiner may show you some tablet, or maximum portion, maximum time they will show you some laminated pictures and the hanging on the wall, and the quality of the pictures are really bad, really bad. So you will have to have very proper conception, very proper knowledge regarding the cadaver structure. There's the identification is very important. If you are able to identify the structure, then he will go to the further questions. Always remember, if you can identify the structure, then maximum time he won't go to the another further questions regarding those identification. So we'll lose a very big amount of mark. So always identification is the must, and if you are able to identify the structure, then he will go to the next stations, next questions, right? So always have a very good knowledge on the anatomy is very important. So practice and practice anatomy. So these are the structures like this way, and he will ask you everything like this way, popliteal fossa. Now this is the time for to break the critical care stations. So for the knowledge portion, I have mentioned that there are three stations. One is anatomy, three type of stations. Anatomy, it comprises three stations, and critical care. Critical care, this comprises three stations, and pathology, it comprises two stations. So for passing the anatomy, for passing the knowledge portions, these two are the trump card. You'll have to have very much focus. You'll have to practice again and again and again and again these stations, because uh, anatomy is very common. They will come to your anatomy cadaveric structure. So whenever the whenever the cadaveric picture is, from where it is taken from, nothing to worry about, because you have gone through these, you have gone through the topic in your conventional book. So just you'll have to identify your way. Just you'll have to very proper conception regarding the anatomy. So whatever the whatever the picture is, just try to correlate everything. So anatomy is the trump card. If you practice very properly, and I can assure you, you will be able to answer, you will able to get more than 50 marks out of 60, and it's very easy to get, I think. Then second one is critical care, and this is the portion to discuss now. Critical care is divided into ATLS protocol, care of critical ill surgical patient protocol, and others. So almost there are 40 stations, 40 stations, and I can assure you, you will get those questions as it is written in your book. Just remember, I am saying again, you will get those questions, critical care questions, maximum questions, almost 80 questions that are written in your book. So if you work very hard on the critical care, very proper way, and from every question is in your heart, whenever you are asked, if you can answer everything, then I think, as there is no more questions, no more new stations, and 80% questions will get in your exam, so nothing to worry about, because all the questions are your known questions, so you'll get very easily the mark, is not a problem. So always give emphasis on the critical care, because it's the open book question. If you go through the stations very properly, then you will able to get the mark, nothing to worry about, right? So let's come into a critical care question. So the question is written inside the in front of the door, and you will have 1 minute, 1 minute, 1 minute in your hand. So the bell, the bell rang. You have started to read out the question. So 60 years old chef involved in fire, he was trapped in the kitchen for 30 minutes. When he was brought to the emergency department, his pulse was 100 beats per minute, blood pressure 90/50 millimeter mercury. He sustained burn covering his chest and abdomen, right and left lower leg, right upper limb. He was in severe pain. The burn looked erythematous and blisters. Then the 1 minute finished, and you are asked to enter into the room. What about the next question? So, did you get the what really happens on the exam, my dear friends? Did you get what really happens in the exam? So you will get so many stations in out of 18 stations that might happen 2 to 3 times that you couldn't finish the question because question is very big and you couldn't finish. So what about the rest portions? You haven't gone through this portion. So the thing we'll have to do whenever you enter into the room, the examiner, this is examiner, this is the table, and this portion is you. Examiner, you ask you, have you read out the question, doctor? So you will have to always answer, sir, I couldn't finish, would you please give me another chance? So examiner will give you another chance. So whenever as you couldn't finish this portion, so you don't know what really going to be asked you. You are not oriented all the scenario that is written on the door. So you are not, that means you couldn't finish your question. That's why you are not able to answer everything. That's why you will have to, I request you, you'll have to ask the question again. The 9 minutes has already been started, and when you will ask the question again and just spend 30 seconds or 40 seconds to read out the rest of the question. Nothing will happen again. If you are oriented about the stations, 40 seconds is nothing. But if you are not oriented the question, there will be a very big situation, very bad situation. You won't be able to answer anything. So you will, this is taken from my practical life. So you won't be able to finish the question sometimes. So you'll have to ask the question inside the room. Then examiner will ask you so many questions regarding burn. At first, the patient examiner will ask you, can you tell me the percentage of burn, doctor? How you treat? What is the management of the burn? How will you treat it? So why would you prefer crystalline solution other than colored solution? Like this, sir. Always remember this way. This is a very vital scenario I have discussed with you. You sometimes you won't get enough time to read out the questions. So always ask for the questions, finish your questions, then start answering the questions. So now, did you get it, guys? Did you get it? Critical care, did you get it?
Yeah,
You
Yes,
things
Mr.
like
yeah.
ECG, X-ray, and so many things. This portion regarding this situation, pictures he might show you pictures which in X-ray what is showing ARDS. Then the examiner may ask you regarding the ARDS, what is the ARDS, what is the treatment of ARDS, what the complications of burn. So many things regarding that are written in the book, or they read in every time. Nothing to worry about the questions, but these things are very vital for the exam because nobody will tell you about the situation. So who are appearing for the very first time, the second time or third timer doctors are oriented because they have they have tried once, so they knows everything about the stations. But who are appearing, maximum doctors in MRCS Part A exam, I think it's my experience, maximum doctors who fail in the MRCS Part A exam, maximum are first timer exam, and the doctors who pass in the second time, maximum doctors who pass from the second time because they are very much oriented in the exam. And the problem is our guide who guides us, they don't really discuss about those situations. They can teach you everything regarding the burn, regarding the complication, this properly, very properly, that's okay, but they won't discuss about this. It's the main problem. If you don't get any 2 or 3 questions regarding the topic, nothing will happen. Just remember, nothing will happen. But if you can't read the question or answer the question properly, that's really matters, and that will bring you to fail. Did you get it, doctor? Did you get it?
Yes, Bhaiya.
Yes.
Okay. Now come to the pathology station, and I would say, I'm extremely sorry to say that, and this is the toughest structures, toughest portion, pathology stations. Why it is tough? Because there are almost 40 plus stations in our pathology portion. 40 plus stations in our pathology, and you will have to face, and every time doctors are facing new stations here. I already said you won't get any new stations from the critical care, but you will get new stations in the pathology portion. So and remember, like I have discussed in critical care regarding the burn, and I have discussed about the ARDS, and this is the combined with the burn. So as it is, you will be asked regarding the burn as it is written in your conventional book, or you are going to the whatever the book is, everything is okay, same. So it is written in your book. So you are directly asked those questions. But pathology questions are different way they asked. How these questions are asked? There are 2 stations in the pathology. You will get new stations here. Sometimes if you are not that much lucky, but stations are more than 40, so you'll have to go you have to go so many stations for 2 stations. So come to these stations. These are pathology stations. A young lady came back from foreign travel with cervical lymphadenopathy. So you will give this kind of scenario inside the in the door again, another exam station. This is the room. There will be written this kind of station. You will get 1 minute to read out the question, then we will enter in the room. And this is the examiner. This is the examiner. There is a table here, and he will be starting asking for the 9 minutes. So in these stations, why I'm saying it is that difficult, I'm discussing again. You will get new questions here, and the problem is pathology stations every pathology station comprises 2 or 3 stations. Like in this scenario, you will be asked regarding tuberculosis mast. You will also maybe asked regarding abscess here. So in our book, if you have gone through this book, so you will get abscess is one station itself, and tuberculosis is another station itself. So pathology stations is not always a complete station. It always comprises 2 to 3 stations. Examiner will ask you 2 to 3 stations at a time. So pathology is difficult. I always say pathology is difficult because you will get new stations here, and every single station comprises 2 to 3 stations. So you may be asked in anywhere in your book. So nothing to be worried about. I think how will you pass? Just have a look. If you get 50 in anatomy stations, and if you get critical care 50 in critical care stations, then you only need 10 out of 30 in pathology. So you will get 110. So it's very easy to get the question. The main problem is our doctors who are appearing the exam, they don't really know about the distribution of the mark, where to focus, where to give the emphasis. They don't know how to start the preparation. They give I have seen so many doctors in my life. They give so many emphasis in the stations in pathology, but for giving the so many emphasis in the pathology, they ignore the anatomy and they ignore the critical care. So is it easy to pass for those doctors? Dr. Nahida, is it easy to pass? Hello, are you there?
जी भैया.
So is it easy to pass for
Yeah भैया, of course,
definitely
under
not.
your
So,
guidance.
yes, so I always request you just just become a very competent regarding the anatomy. Go through the questions, go through the pictures from various books. Just make yourself like a combo. Always and try to focus the pictures from different sources. Then critical care, you will ask the critical care as it is written in your book. Just go through the pathology stations and how those are written in your book. Don't ignore. I always request you, focus as it written in your book. Just don't nothing to give more emphasis other than anatomy and pathology. Always give emphasis on the pathology and anatomy, and try to cover pathology as it is written in your book, but never ignore anatomy anatomy critical care for pathology. Okay, that make you pass, I think. So
which book do you use to study for our preparation?
I have gone through so many books, because I am teaching FCPS or residency for a very long period of time, and I'm a combo, right? So I am having to go through so many books, but some of books are combined. I'm trying to make a complete version of these books, especially for the anatomy. Critical care is okay, but anatomy is not complete. But that's why I'm trying to make a complete book for the anatomy, so that you guys don't have to go through any other books, I think. So, guys, do you have any question regarding the knowledge portion? We have completed our knowledge portion, and now we'll come to the most difficult portion, that is the skill portion, and maximum doctors, I think more than 70 to 80% doctors failing the skill portion. Is there any question regarding the knowledge portion, doctor? Jafri bhai, are you there? You are from part A
Yes,
exam MRCS. Congratulations.
Thank you, bhai. I'm here listening to your all advices.
No worries, brother. You are a gem. I know. I know everyone, almost everyone from who are appearing in the group, and everyone very personally, and you guys are really super. So just you'll have to have very much focus, and you'll have to prepare yourself very smartly. And I think smart OA studies is the key to success. Dr. Tanvir bhai, do you have any queries regarding the knowledge portion? Bhaiya. Okay, I think Tanvir bhai is on the road. Now come to the skill portion. So I will always tell you, skill portion is the toughest one if you don't know, and if skill portion is the easiest one if you know the strategies. First, go to this word. What is written? Dr. Nahida? This is skill. So
yes,
skill is the thing that you won't get in a day. I again repeat, skill is not the thing that will get or develop in a day. Skill is the thing that we'll have to develop day by day by practicing. Always remember, skill is the thing that we'll have to gain or develop day by day by practicing. And practicing is the key. I have seen so many academies or so many mentors who have completed the knowledge portion, who had completed the other things at first, then just at the 11th hour of the exam, they come to the skill portion. So the candidates don't get to practice the skill portion. They don't. So after having a few days, like 10 to 15 days, just 10 to 15 days before the exam, you have completed your just first time of the skill portion. So is it possible to complete so many skill portions, so many skills within 10 days? Is it possible? So I always suggest you, start your skill portion from the first day. From the first day, because skill is the thing that you might fail and it won't be developed in a day. That's why you'll have to start your skill portion from the first day of your preparation. Just go through a simple history taking. For a simple history taking, go through a simple examination, single examination, no problem, because all the strategies of the examination are the same. All the strategies of the history portion is the same. So if you go through the one history taking in a day, then from the second day, almost everything you have read out the first portion, first day, because all the almost all the history stations are same. So I would request you, don't dare to forget to go through the skills in a single day. Just practice your skill from the very beginning, from the first day of your preparation. Don't dare to forget or ignore the skill portion, because the portion you'll fail. Definitely note it down. So what are the stations? There are total 9 stations, 20 marks each station, and 20 into 9, almost 180 mark. And what is the pass mark? I have already mentioned that in case of skill portion, pass mark varies. It always varies. I have seen 116 to 118, 116 to 118 pass mark. So sorry, 100, not 118, 122. Sorry, 122. Minimum is 116 and maximum is 122. So you have to focus to gain more than 122, and if you get more than 122, you are pass, whatever the station is and wherever the center is, nothing to worry about. If you gain more than 122, and you will pass. Now come to the stations one by one. Station distribution. So what are the stations? I have already mentioned. You will get total 9 stations, 3 stations from the examination, 2 stations from the history taking, 2 stations from the communication, and to the procedure. So just remember how many stations are there. For the examination, you'll have to go through almost 21 examination, 21 stations. You'll have to practice 21 stations, and history taking almost 21 to 23 stations. In person, just 5 to 6 stations, 5 or 6 stations, like 6 stations. Phone call, 5 or 6 stations, 6 stations. So you will get 3 stations from out of 23, 2 stations from 23, just 1 station from 6, 1 station from 6. And procedure, you will get, for the procedure, there's almost 6 stations. Just commonly comes in exam, you will get 2 stations out of 6 stations. So it's very simple. Just you will have to face 3 stations out of 21 examination. You'll have to practice 23 history, and you'll get definitely 2 stations. You'll have to practice 6, and you'll get 1 station. Practice counseling, you'll get 1 stations, and procedure only 6, and you will get 2. So this portion is easier. You might think only 21 examination and you will get 3 stations, so it's not a problem. Only 6 procedure, and I will get 2 stations. It's nothing. But always remember, I'm again saying, is that most difficult portion if you don't practice, because skill portion totally depends on practicing. Why it is difficult? Now come. Time distribution from skill portion, except communication. Just have a look why I am writing here. Time distribution for the skill portion, except communication. So skip it. Every skill portion, at first, now come to the another house. At first, come to the another house. So this is a table. This is a table. This is a table. Like it is a history stations. This is a table, and there are 3 persons inside the room. This one, your examiner. This one, layman examiner, and this one is your patient, and this is your chair. So whenever the first minute starts, you are here and the bell rang and you are asked to read out the question and you have read out the question. So you, after finishing the question, you will enter into the room and you will ask the examiner, hello, good evening, sir. Hello, good evening, sir. The examiner will ask you, have you read out the question, doctor? Yes, I have. So this is your patient. Start your history taking or start your station. They won't even tell you it's a history taking or something else. They just tell you start your station. So you will be sitting here and start your station. So like it is a history taking station. So the very proper way you will start your history taking, there will be a pen and there will be a paper inside on the top of the table, and you will start your station, how it is it will be taught you like this. So you have completed, you will have to complete your station 6 minutes, so total 10 minutes. First minute is the read out the question, read question, then you will get 9 minutes, and 9 minutes and 6 minutes out of 9 you will get to communicate with the patient, to read the, to take the history. Then the bell again rang, and then we will look on the examiner side. The examiner will ask you questions. The questions are fixed, almost questions are fixed. So remaining 3 minutes, you will start your asking questions. At first the question, present your history at number 1, present your history. Then, or the examiner might ask you, tell the positive findings, in case of history taking. So you will tell the positive findings. Then examiner will ask you, how will your investigation and how will you treat the patient. These 3 questions are fixed. Don't go through many more things regarding the topic. Like there is a, you will get one station like tonsillar swelling, or one question from thyroid, and you know the the doctors who was in my FCBS class. I have taught you so many things regarding the thyroid, so many malignancies from the belly lab, you know very well. I have taught you so many things, but for the thyroid malignancies regarding the MRCS, don't ever dare to go through the topics, because you are just asked the prefix questions. One is present your case, one is investigation, and another one is treatment. These are fixed. So now come to this point. What about the layman examiner? What about the layman examiner? So in layman examiner, can you tell me what every history taking station comprises? How many marks? Can you tell me how many marks every history taking station? Hello, are you there, guys? Or I am alone here? So every station comprises 20 marks.
20 marks.
So
20
why
marks.
so lazy, guys? Every station comprises 20 marks. So you will get 20 marks in the history taking. So what's the role of this person, this red person? What is the role of this person? So you will have 20 marks for the history taking, 20 marks, and you will be surprised. You have 15 marks for this examiner. The examiner will give you the 15, and this portion, this guy, he won't interrupt in anywhere in the course of your exam. He won't interrupt any portion, even he won't ask you anything, he won't talk to you, nothing. He don't see, he will just here to observe you, and he has 5 marks in his hand. And this is the place our doctors really failed, this portion. So what's the role of this person? This is the layman person. He will judge you how you deal this patient. How is your approach? How do you show your empathy on the towards the patient? Do you use any medical jargon or medical word with the patient? If you tell the patient is abdomen, the patient on able to understand what is abdomen, just you will have to say tummy or something like this. So you are all completely prohibited to any medical term with this patient. So if you don't show any any empathy like this way. Say the patient is saying, I have pain in my tummy, doctor. So if you say, okay, let it go. For when did the pain start? How does it go and come? It's something like this. So if you don't show the patient some empathy, oh, I'm extremely sorry to know that. Do you need any painkiller right now? So I have seen so many doctors, because I have practiced with so many colleagues or so many seniors or juniors. If you tell that, oh, I'm extremely sorry to know that you are having pain, do you need any painkiller? It's not enough. You'll have to change your facial expression also. That also bears some marks. If you just say, oh, you are having pain, okay, no problem. Just so you are showing empathy, but you are not changing your facial expression, so that you won't get marked in this portion. So it's very important to show your facial expression, to have the empathy, to show the empathy. And always remember, whenever you ask with the patient, your eyes on the patient's eyes. Never remove your eyes in anywhere, like you are writing and you are talking, you are writing in the table or in the paper, and you are talking with the patient. It is very disrespectful for the patient, so you'll lose mark. So I think practice is the key. You'll have to practice how really goes on, how the stations are going on. So whenever you will be practicing under someone's supervision, or with a very expert person or very expert reading partner, then you will be able to identify this portion. Okay. So again, we have 10 minutes, 1 minute for the read out the question, 6 minutes for the section for the practice history taking, and another 3 minutes for the cross questioning. Present your case or present your history or the positive findings, or second one is investigation, and last one is treatment. Okay. So distribution of the communication part, I have already time distribution for
Dr.
the
Ripat,
okay.
I want to know something.
Sure, doctor.
Okay, Dr. Ripat, you've already mentioned that there is a 15 number and 5 number.
Yes.
Okay.
Yes.
Under the layman examiner, which part is under the layman examiner? 15 or 5?
Five, my dear friend, only 5. And it's really
5. Okay.
it really matters. This 5 really matters. And
Yeah.
all the marks are distributed with a various pattern. That's why it's very difficult to get the questions, because all the marks are distributed individually. That's why if you don't focus, or if you don't emphasize the portions, you will get not get the marks. That's why it's very vital. So come to the time distribution for the communication part. For the communication part, always remember, I have mentioned you will get 17 stations for the performing, and you will get plus 2 stations for the preparatory. And so many doctors I have seen, they don't even know about the preparatory stations. So what is really the preparatory stations? Like, these are the first stations. You don't have to face anyone. This room is empty. And this is the second one. This one for the performance. Like, you get 1 phone call stations. I will get all those things later on. So you will at first you will enter into the room. In the table there are so many papers. You will have to prepare yourself for the phone call. I will discuss later on regarding the phone call or other communication portion later on. So you get 10 minutes here. Then the bell will again ring, and you will enter the second your performance stations, and you will get 10 minutes here. These times are not distributed, just whole 10 minutes. I will come to this portion later on. So come to the exam stations. Exam stations are the same. Like, there is a question in front of the door. Present with shoulder pain, right? Again came to another house, another exam room. So this is the room, and this is the question, and this is you. And is the bed inside the room. This is the bed, and this is the table, and this is your examiner. So your patient is here. Your patient is here, and there is also another person is present here. Sometimes he may present or sometimes he's not. So at first, bell will ring. You will get 1 minute to read out the question. Then you will enter into the room. And examiner again will ask you, have you read out the question? My answer will be, yes, sir. Okay, start your examination. So you will start your examination the way you learn. You have completed. Sometimes you might need someone's help, like in case of what it said, in case of knee examination or in case of vascular examination, in case of varicose vein examination, you might need someone's help. So this person will help you. So maximum time there is nowhere in the room, but where there is any assistance is needed, there will be definitely some assistant. So after 6 minutes, after completion of the examination, the examiner will ask you to his bed, and all the 6 minutes he is observing you from here. He won't interrupt in any course of your examination. Nothing. He won't say nothing. He won't interrupt in anywhere in your examination. He will just observe you. What are you doing? How you approach? Whether you are washing your hand before or after finishing the examination. How are you looking for a chaperone of the patient? What is your approach of the patient after finishing the examination? Whether you are helping the patient to put on the gown or not. Are you properly give the patient proper instructions or not? Are you aware of the patient's pain? So everything he will observe. Are you going through the every single steps? So after completion of the examination, you will come to this portion. So here is 1 minute, and you will get 6 minutes here, and you will get 3 more minutes here. So same thing again here. Present your case. Present. So what's your diagnosis? Diagnosis. Then how will you investigate? And lastly, your treatment. These are the questions, fixed questions. These are the fixed questions that are given in your book. So now question is, all the things are written in our book, but still why we are failing? Why we have practiced so many doctors said me, I have practiced so many times, but still I'm failing. Why? What's the problem? Problem is just you have a poor mark, very negligible amount of mark to perform the examination properly. Very poor mark. The mark are distributed in various ways. Like you have mark for the hand washing before and after. You have mark to show empathy. You have mark to counsel the patient. You have mark to seek for the permission. You have mark to exposure of the patient. Exposure. You have mark to show, to build up the rapport of the patient with the patient. You have mark to redress the patient. You have mark to have the consent of the patient. So you can see all the 20 marks. After that, you have marks to face the cross questions. So all the 20 marks are distributed along this way. I have seen who can answer anything in the exam. Shoulder is a very uncommon thing that comes in the exam. So, and another examiner who was asked about the cerebellum. So in a course of the examination, the doctor entered, and he was saying, doctor was saying, have you read out the question, doctor? Yes, I have read. Perform your procedure. So the thing, what happened really? So doctor said, sir, I don't know anything regarding the regarding cerebral examination, shoulder examination. So he don't anything because he couldn't practice regarding the cerebellum or shoulder. The examiner asks you, do something, do something. The examiner will just emphasizing doctor, just do something. So what he did, he did gave his identity. Hello, I am Dr. Rifat, one of the surgical candidates. May I confirm your name and age, please? Today I have been asked to examine your cerebellum. That includes looking, feeling, walking, some special tests. Are you with that? For the examination purpose, you'll have to expose your this portion. Are you with that? Do you have, regarding before starting, do you have any pain? All the 5 questions I have mentioned, every 5 questions comprises individual mark. So the thing is, you have just poor amount of mark for performing the examination. Nothing to be worried about, my friend. If you don't know the examination very properly, nothing will happen. Just always try to focus this portion. Focus this portion. You have 2 marks only for the hand washing before and after. So never forget to do these things, because examination station is very important and this portion really bears so many marks. If you do this thing, you will get the marks. Just do some examination, that's okay, but these are the main point. Always try to remember. So do you think if you don't practice very properly before the examination, you will have to cover so all these things? Is it possible if you don't practice properly from the very beginning of your preparation? Hey, doctor.
Not at all.
Okay, right. So I already mentioned you, skill is not the thing to prepare just before the exam. Skill is the thing to start your preparation from right now. And if you practice your preparation skill from the very beginning with a very expert person or with a very expert reading partner, I would say nothing will happen. You pass definitely. I can write it down. Okay. So is there any question regarding the examination stations?
Yeah, is it mandatory to ask for help from the assistant that is present during these examination sessions?
Any for any assistant?
Yes, like if the assistant is present, is it mandatory to ask for help even when I don't need it?
Whenever there is any assistant is needed, whenever any assistant is needed, the assistant would be always in the examination room. In some cases, like in a exposure of the private part, like in portion of our chest examination, in my station, my experience, I got an patient regarding the mitral regurgitation, and that was a female patient. So I had to expose the patient's chest. That's why I need some chaperone, and chaperone was there present. So I just mentioned this lady or this person or my examiner will access chaperone, nothing to worry about. Like this way. These things are just for practicing. You'll have to practice in a proper way. So when there is any assistance is needed, the assistant will be present all the time in the room. Nothing to worry about. But if in case of exposure of the private part, always mention about the chaperone, whether the chaperone is already present or not. Don't ever dare to forget mention about the chaperone. Always, if the person is just besides you or beside the patient is already been presented in the room, always mention this lady or my examiner, this person will access chaperone. Always, because you do have mark for this sentence or this word. Get it?
Okay, thank you.
Okay, fine. So I have already mentioned regarding the history taking. Just again, in pre-admission clinic, planning for a planning for cholecystectomy, shortness of breath for few minutes, increase the frequency 6 weeks after being scheduled for operation. So you will get this type of question, 2 to 3 sentence. So you will be able to answer whole the question within 1 minute. Nothing to worry about the history taking question. So so after 1 minute, you will enter into the room. You will start your history taking question with the patient, and then you will discuss. The examiner will ask you the questions about 3 questions: positive finding, diagnosis, what is your sometimes your differentials, and how you investigate the patient and how you treat the patient. And there will be also another person who is layman and who will observe you, and she has some marks on her hand. Are you okay with that? Still now, are you okay with that, guys?
Yes.
Okay, fine. That's great. So now to Dr. Sulaiman. I think you are making some noise, doctor. Okay. Now to the procedure stations. So procedure stations are the simplest stations, because you will have to very much expert on only six stations, and you will get two stations from these six stations. So you get two stations out of 9 from procedure, and just you'll have to practice only 6 stations. So it's very easy, and I don't really don't know why all of our doctors are doing very bad in the procedure stations. It's a very matter of sorrow. It's a very what to say, it's a very disappointing. All the doctors in our country, they can't do procedure stations, because just they have to practice only 6 stations, but they can pass, they can get the complete mark from the 6 stations. So what really happens in the procedure stations? Like, it's very important, just have a focus on the topic. This is a house, and this is the room, this is the examiner, and there is a tray, right? I'm just telling about the nevus or abscess janus or something else, like performing procedure, right? So this is the examiner, this is the table, and here is a assistant, and here is a couch for you, couch. There is a patient on the couch. So what really happens? There's a couch, there's a patient lying on the couch, there's a tray for instruments, there's a helping hand or assistant, and there's the examiner. So you get 10 minutes, this is the door, and you will get 1 minute to read out the question. So after finishing the 1 minute, you will enter into the room. So examiner will come in front of you, and examiner will ask you, have you read out the question? Yes, I have read out the question. Okay, now start your procedure. So there is a chair here. So just abscess, like this is the abscess, this is a thigh, this is a knee, this is abscess. So we'll have to remove this abscess. So after coming to the patient stations, these procedure stations have some rules, 10 rules. I think all who are already prepared for the stations, you already know that some rules, 10 stations you will have to focus. At first, you will have to start, hello, I am Dr. Rifat on the surgical calendars. May I check your wristband? If the patient is indoor, and we'll have to check the wristband, or admitted patient will have always wristband on the patient. So you don't have to ask the patient's identity, because if the patient is already been admitted, and then you will have to confirm by watching the wristband. So in this case, if there is any wristband in the patient, so always have a focus on the patient's hand. Hello, I'm Dr. Rifat, one of surgical candidates. May I check your wristband? Yes. Today I've been asked to remove a dirty mole or dirty soiling that is present in your thigh. Are you okay with that? So nothing to worry about. That will be done under some local numbing agent. So you are not using anesthetic agent. So local numbing agent. Are you okay with that? So before starting, do you take any blood thinner, or do you have any analgesics like this way? So you will have to ask the doctor or your professor, sir, I would like to check the WHO safety checklist. Is the right patient, right side, or right procedure have been performed, or if the patient is taking any blood thinner or something, if the patient is allergic to anything, if the WHO checklist have been checked or not, if the written consent has been taken or not. So these things will be have to focus. You'll have to just a bullet. You'll have to just doing. See, I have completed my exam 1.5 months back, and I'm just it has been converted into a reflex like this. Just I'm saying everything spontaneous. So you'll have to say everything spontaneously like this way, and you'll have to have a checklist of 10 things, 2, 3, 4, and you'll have to focus every single thing. So, and every single thing do have mark. If you don't any step, that means you are losing mark. After completion of your procedure, before the starting the procedure, you have to check is the patient acidic portion has been developed or not. After completion, hello doctor, please mute yourself, doctor. So after having the procedure, you'll have to discard all the sharp beans, sharp instruments, sharp bean or dirty bean, whatever it is. After completion of the procedure, you'll have to document the procedure. At least there might not be a chance or anything to document the thing. Just you'll have to mention, sir, I would like to document the procedure. That really brings carry some marks. So always, if you focus these 10 things, that will have mark. So don't ever to forget, or don't ever to go just like 6 stations, nothing. I have done so many big major surgeries in my life, and these things are nevers or abscesses or something. These things are nothing. It's nothing. I will perform. But my dear friends, performing has a very little amount of mark. You do have mark other than these things: hand washing, singing permission, and so many things I have discussed. So if you are doing these things, you will get mark. Otherwise, for the performing of the procedure, you won't get any mark or some little amount of mark. So what really happens in our exam, I have seen so many doctors or so many senior junior colleagues where I did very well. I did excellent in the procedure. I did excellent in the suturing. I did excellent performance. My own margin hypothesis so beautiful, perfectly. So why did I fail? You didn't do these things. These 10 things do have mark. This thing carries the maximum amount of mark, and you didn't follow this portion. That's why you have failed. Did you get it, doctor? Hello, guys. Did you get it?
Yes.
Yes.
Yeah.
Yes, Bhaiya. Nicely explained.
Okay. So now come to the communication stations. Communication stations, I have mentioned this. These are the toughest stations. Toughest stations is the communication stations. But when you are preparing for these stations, you might think is the easiest one. My dear friend, just note it down. When you will go through the station, or you will read out the stations, you'll think, oh my, it's nothing. It's just silly. It's nothing. Just what you will really do, you just have a go through the stations and you will start practicing. That's okay. But this stations is really difficult because it has two portions. One is person counseling and another one is phone call. So at first go to the patient counseling or counseling portion. So at first in communication station, we have said you will have 2 rooms in a row. This one is the first room and this one is the second one. So in the first room, there will be a question paper here, and there will be a table, and this one is the preparatory station, and this one is the performing station. So you will get total 20 minutes. This one is for 10 minutes, and this one is for 10 minutes. So when for the first minute you will read out the question, there will just 1 to 2 lines written there. Just you will have to face something, a communication. So at first you will enter into the room and you will get no one inside the room. Just there's a table here, and there are so many papers, and there's a pen and there's a chair, and you have 10 minutes in your hand. So at first, the thing you will have to do, you have so many papers. I think it's very bad experience. Just 15 to 20 pages are written in this file. This is a patient's file from the very beginning to the up to the date. From the very beginning for today about the patient files. So there is a history, there's an investigation, there are some findings, there are some referral papers, and so many things. There are so many investigations. So the problem is you will get only 10 minutes. So you if you are not habituated this thing, it's really difficult those things to pick what is really needed. So you'll have to very much oriented regarding those things that are needed in the table, and you'll have to keep ready, because you have to face some station later on. So I have already mentioned person, there's some 7% station. So my request would be just go through all the stations, all the findings, all the investigations, all the X's, all the scenarios again, and again. If you do think that you will prepare your file by reading out all the papers inside the room on the table, and you are going to do a very big mistake, because there will be some refer papers what will be written like this way: Nahid Hassan refer, like this way, and you won't be able to read this thing. So you'll have to prepare yourself from right now. You'll have to go through all the stations. You'll have to memorize all the findings by your heart. So whenever you will enter into the room, and whenever you will able to identify this is the counseling portion of the subcapsular hematoma, then we'll have to remember the patient is young, and he was going to watch a rugby game, rugby tournament, and he was drunk, he was fell down, and his hemoglobin dropped by 1 gram for 10 to 9, and something like this way. So you knows everything before starting the exam. From outside the exam, so just enter into the room and just correlate the things you have remembered, whether hemoglobin is dropped by 1 gram or 2 gram, whether the patient was going to see the rugby game or football, like this, sir. Just cross check. Nothing. Don't dare to pick new information from this portion. Don't. If you think that I will read out the whole thing and I will prepare my station, you are going to do a very big mistake, because you won't get any time to prepare yourself. So prepare yourself here, then you will be asked to go to the next station, and this is the performing station. So what is really going on in the performing station? So this is the table. And this is the examiner. This is layman examiner, and this is your patient, and this is another chair for you. So after you will get 10 minutes or 9 minutes here. So you are this person, and after entering the station, the examiner will ask you, are you prepared for your sessions, or have you read out the sessions? So you will say, yes sir, I am. So start your counseling portion. So you will start talking this person, your patient. There's some kind of prepared stations like angry patient, angry mother, something like this, angry wife, especially angry wife, Dama, discharge against medical advice, something like these stations. So the interesting thing is, all the 10 minutes are performing inside the room. These two person won't talk to you for a once, not for even single time. This examiner won't talk to you. These stations totally will be run with the patient. They even won't interrupt you. They won't ask you any questions. They won't cross-check anything. These two portion, the examiner will just observe you. So this examiner is this one is the examiner, and you will be surprised. This examiner has, so how many marks does the station carries? How many marks, Dr. Sulaiman? How many marks does the station carries?
20 marks.
Yes, 20 marks every single station, right? So
Yes.
this examiner has 12 marks out of 20. 12 marks. And another, this examiner has 8 marks. 8 marks of answer. So just think about, this person is not a doctor. This person is a layman. This person is a patient, and this person is examiner. So the examiner will observe your medical terminologies, not the terminology, medical knowledge, and this portion, how you talk about the medical depth of the knowledge, medical knowledge mainly. And this person, this layman person, will observe your body language, even if you are nodding your head nodding, nod head, eye contact, apologize, are you apologizing the patient or not? Are you comfortable with the patient? Are you able to deal the patient or not? So this portion are there. So in maximum candidates I have seen in my life, nobody ever tell me that he has done very poor performance in the person or counseling sessions, because the examiner won't ask you any questions and nobody will talk to you. Just you'll have to talk with the patient, and that's the whole thing you'll have to do in this portion. So as he is not going to asking any questions, you don't have to face any questions, just you are talking with the patient. So nobody nobody never tell me that their examiner was bad or something else in the stations. Everybody will say their counseling or person stations was really good, but they, in real situation, in real life, they really get very poor amount of mark in this portion, because these things are very crucial. These things are very important, because maximum doctors lose their mark this portion, because they just say, okay, they just counsel the patient. They say everything. Whenever the patient is asking what is the arthroscope, doctor, I don't know. So they will the doctor will ask you the I'm coming to another patient counseling like this one. Just I'm going to through these stations, patient counseling, right? 6-year-old man came to you, history of smoking, alcohol present with dysphagia. If consultant has gone off for a meeting and you are asked to consent for OGD, biopsy and dilatation under general anesthesia, patient is constantly salivating and weeping and hand closed or something like this. So the scenario is the patient is very afraid to go for the esophageal gastroduodenoscopy, and you have to counsel the patient to go for that procedure. So the problem is, most of our doctors are saying, or most of our doctors just saying about the patient, about how the OGD is done. But whenever you will draw a paper like this, this is your food pipe, and this is your stomach, and this is your first part of the small bowel, and we just, and this is your mouth. We just insert a flexible tube through your mouth and go through the food pipe, then the stomach, then to the first part of a small bowel. So that will definitely will be easier to understand for the patient. So if you just say I will insert a flexible tube, a flexible scope through your mouth, then to the food pipe, then to the stomach, and then to the duodenum, or then to the first part of the small bowel guard. So you will get might 2 or 3 out of 5, but whenever you will draw this picture, you will get 4 or 5 out of 5. So that mainly difference makes the difference. Doctors are doing very well in the portion, but if you are not expert, if you are not practicing like this, so you won't really get that much mark, because it's really practice with the proper way, with the supervision. So it really matters. So it's very difficult. People usually do very well in the exam, but they don't really get any marks in this portion. Did you get it? Counseling portion, person counseling.
Yes.
Yes.
Do we get any paper or pencil for
Yes, definitely.
about the procedure?
You have paper here. I already mentioned that there's a paper here. You will get a full patient file. Then you will note it down, or just cross check everything. Then we'll bring the paper to the patient and have a paper on your hand and everything. So when it is needed, you will show the paper of the patient, then just start to counsel the patient. This is the thing.
Okay.
Our doctors really don't do this
Regarding history taking session, I have
Yes,
a query.
I have already
that-
mentioned to you that you have some paper on your hand on the history taking stations
Yeah.
also. But
And
there's
I
some
would be
peaks.
permitted to read
But there are
something
some
about
peaks.
the positive findings.
In case of history taking portion, if you are doing the both thing at a time, like you are writing in the paper and talking with the patient, you will lose mark, because you are
Oh.
completely prohibited to speak with the patient when you are taking the history. Just whenever you talking to the history, you will have to have your full concentration on the patient, and other time you'll have to focus. I will if you will have some mock session, I will show you how to take this scenario or take the history, right?
Okay. So how we will use the papers in case of history taking session?
There will be paper in front of you in the table. There will be always present some paper and pen in the table. Did you get it, Dr.
Okay.
Sulaiman?
Yes.
Did you get it?
Thank you, Bhai.
Okay, no worries, brother. So,
Yes, yes.
and this is the phone call, and all of you who are present here, I'm telling you, I was very much afraid of this portion. I was very much afraid this portion because it's the toughest station. It is the very difficult stations for the whole MRCS, and who are appearing for the MRCS exam. He will definitely say you, or who have failed in the exam, maximum time they couldn't do very well in the phone call, because how the stations really goes on, I am showing you. At first, you will have and prepared stations, and this is the room or the performance, and there is a table inside the room. There is a chair here. This is a chair here, and there will be a phone call, receiver phone call like this, and sometimes a phone number is written here or in the wall. So you will have to, and this is the prepared stations, this is the table like this, like the counseling portion, and there's so many papers in the table, and this is you just enter into the room. You will get 10 minutes to prepare yourself in the prepared stations, and here you will get so many papers like the previous one. You will get so many papers like the counseling portion here, and you will have to record every single thing within 10 minutes. So it's really difficult, and like this way you will get 15 to 20s, or it's really varies 10 or 10, 12 or 15 pages in the table, and you'll have to go through all the pages and all the recent investigations of the patient, all the history, all the current finding, all the investigation finding, all the X-ray finding, all the ECGs, all the current situation of the patient, all the referral notes. There will be so many things in the table. So is it really possible to finish everything and note it down within 10 minutes here? Is it possible, Dr. Sulaiman? Is it possible, brother? Within 10 minutes? Are you there? Dr. Kaushik, is it possible to make note within 10 minutes here?
No, it's
Yes.
very difficult.
Yes, it's very difficult. So I would always suggest you, phone call, just you will have to memorize every single thing that are written in the phone calls short notes. You won't get just these are the from the conventional notes from the books. These things are just summary, but you won't get this thing in your real exam. You will get 10 to 20 pages here, so you'll have to go through this paper. And if you want to prepare yourself within 10 minutes, it's totally wrong conception, because these things are, some are typed, some are handwritten, and some are very special digits like this way, and it will be very difficult to understand what is written in the paper. So I would always suggest you, always remember, like this is the annuria stations, and we'll have to you have to ask, you have to able to tell me what really happens on the annuria stations, what was the operation, what was the that was a post-operative day of hemicolectomy. What was the temperature? What was the blood pressure? What was the take? What was the pulse rate? And what really happened on this case? So you have to memorize all those things. And Alhamdulillah, I have prepared myself regarding my exam, regarding how to prepare phone call stations, like at first scenario, then investigate, then clinical findings, then investigations, and how's your plan, everything. So you will have to prepare yourself like this way, and when you will be able to answer this question, then the phone call station won't be a problem with you, because you know everything. Just you will have to cross check everything. The potassium count is given in this paper, like you have read out in for preparatory stations, or the patient is mastectomy or lumpectomy. This thing varies. I will discuss with you regarding during a mock session or something else. So after having the 10 minutes, you will enter into the room. So I have already mentioned you won't get anyone inside the room. Just you will have a phone here, and there is some phone number, and you'll have to call the person. So there is a common problem. Sometimes when the phone number is not hanging on the wall, it on the table, sometimes some candidates bring the phone number with them when they leave the station. I have seen so many better experience, and so many doctors that they was just fighting to have the phone number for 2 to 3 minutes, because the previous candidates took the phone number with him, because it was a paper, and he also have paper, because they take the preparatory station preparation here, and after having the station, just take the paper, and there's a basket here. You have to put the paper here. So the candidate sometimes was just fighting to find the phone number. So what really do nowadays, the phone number is hanging on the wall, so it's not a big deal. But if you don't have the phone number, just there are so many person outside the room, candidates who have already passed the MRCS exam. They are volunteers. So you will just rapidly come to the gate and ask the volunteer, sir, I am not having the phone number, would you please help me, son? Then he will manage you, he will rescue you. So whenever you will able to make a phone call, then the receiver will someone will take or professor will take the receiver, and will start talking you, and we'll have to focus so many things. You'll have to identify, you have to give your identity, and we'll have to confirm whether you are which person you are looking to, whether he is not, or he is or he is not. Then we'll have to summarize your case. You have to discuss clinical knowledge, everything that will be discussed in your class, that had been discussed in your class. Did you get it? The phone number is the difficult one. It's really difficult. If you don't really can remember this thing, it will be really a big disappointing thing for you, because you won't be able to do well in the phone call stations. Did you get it, doctor? Hello? Just
yes, yeah.
Some answer, please. Just participate. Okay, so I have discussed everything regarding the stations. Now come to a very vital thing that I have discussed, is the summary of all the thing I have discussed. And maximum of the doctors who are appearing in the exam, they don't really know how the marks are distributed, because very important, very important. That's why maximum doctors from our country are failing in the skill portion, because every single step really bears some stations in the procedure stations. Doctor, our candidates are thinking all the marks are on the procedure. No, brother, procedure itself do have a very minute, a very small amount of mark. The mark mainly distributed among all the other steps that we'll have to gain or have to develop the skills by practicing. So come to this portion. This thing launched on October 2022. There are total 17 stations. This stations is the knowledge portion, and this is the skill portion. So in the knowledge portion, there are anatomy portion, there is pathology portions, there are critical care portion. So the three critical care portions do have itself 20 marks. So all the sessions carries 20 marks. Now come to this portion. So another three portions, all the another three portions do have the clinical knowledge and application. I have already mentioned what is the structure, what is the nerve supply, the function, what is the clinical importance, what will happen if the nerve is injured, what will happen. I have, is there malignancy, what's the type of malignancy, like this way. They will only see your clinical knowledge, nothing else, and application. In surgical pathology, also same. There is no professionalism, something else, nothing else. But come to the critical care. In critical care, portion as distributed. Like you do have knowledge, 12 mark, all three 12 mark, but clinical skill, 4 marks, some professionalism, 4 marks, and our doctors are really don't aware about this portion, because whenever a scenario will given in front of you, like they'll show you an X-ray, they'll show you ECG, they may show you something else, they will show you a blood picture. So they will ask you what's going on, what's the wrong with this. So you will have to answer very professional way. You will have to, you can't say directly the patient is developed hypokalemia. You at first you'll have to say this, the patient's potassium level is 3.1 or 2.9 something else, and patient is hypokalemia. Then the patient asks you what the ECG changes of hypokalemia, like this. These are the professionals. Very smart way. You will have to just, whenever you will go to the round in your ward with your professor, when in the bedside, they will ask you to interpret the X-ray, interpret the investigation. So you'll have to answer very professionally and very confidently and very smartly. So if you can do this, and then you will lose some mark. So clinical and technical skill you'll have to develop. You have to develop some professionalism, how to interpret the X-ray, how to interpret the blood picture, how to answer the patient, what is the planning, how is the safety, so many things. So our doctors are not really aware this portion. They know the knowledge, they know the clinical knowledge and its application, but they are not aware this portion. So that's why they fail. So these are the knowledge. Now come to the skill portion. So have a look, clinical knowledge or its knowledge and its application carries like this. I have already said you have some layman examiner in the history portion, this portion, some assistant this in the procedure. In examination station, you have some patient, you might have some special cases, you might have a assistant. That varies, but usually one patient, one examiner in the examination station. So always remember there is a layman, surgeon, and one patient. So this thing, then clinical knowledge varies 4 like this way. Then clinical and skill, the examination itself only carries 8 marks. So whenever you are doing a very well examination, you are thinking that I have done very well, but another 12 marks distributed. So you'll have to focus another 12 marks. I've seen one of my younger brother. He said, I couldn't answer some questions, but I have done very well in the examination. He might have some marks on the examination portion, but he couldn't do very well in this portion. So 12 marks depends on this portion. So these things really carry some mark. The mentors or your partner or the expertise who are you are practicing with, he might show you how to examine the patient, what are the examination, how to interpret, but he won't tell you this portion, because he even don't know. I have seen so many doctors who have passed, but he don't really know this portion because he has practiced with a very expert candidate. Right, this portion I have mentioned. Procedure skill, I have already said that. And procedure technical, this portion. Technical means we have some procedure skills like suturing or something else like this. So come to this last portion, your examination, after examination, whenever you will appear in the exam, you will get this portion just 3 to 4 weeks after your result. This is your whole mark distribution. Like your score, your OSCE result, there will be written pass or fail. Not fail, just remove it. You have been passed. Just say you have passed. Then you will have some mark, your mark for the knowledge out of 160, like 110. Your knowledge on skill out of 180, like 130. Like so, there will be written mark out of 160 required to pass 106. Mark out of 80 required to pass skill 118. So what's the result? You have passed. So these things, this thing will be mailed from your Royal College. If you pass, or if you don't pass, that will be. And then this portion is very important. This portion is very important. Okay. Anatomy and surgical pathology, like anatomy 3 stations, anatomy 3 stations, and pathology 2 stations. In total 5 stations and total 10 marks. So you'll be given how many marks you have. Just you gain 80 marks out of 100. So mean marks. So what about the mean marks? That will be analysis. So analysis for if you fail, that really help you. If you pass, that don't help you that much. But if you fail, then you will be able to identify what was your weak point, where you couldn't do very well. So to analyze yourself. This portion, same thing, just have a look on this. So what is the eligibility? So for passing sitting for the MRCS Part A exam eligibility, just you'll have to pass Part A MRCS. No training is required. No training is required is the eligibility. So how to crack? Now you'll have to think about how will you break, or how will you prepare yourself. It's a very easiest exam. If you know you have faced so many exams in your life, like professional exam, I always like to say I didn't in MRCS Part B exam as I have read in my professional exam, because the syllabus was huge in medicine or surgery or something else. But MRCS Part B exam, the syllabus is very small, but the thing will have to develop your skill by practicing day by day, day and day. So how to crack? At first, you'll have to have a very prior planning. You'll have to plan within like I'll have to pass MRCS Part B exam. So it's your plan. So how will you make your time? You'll have to find out your proper time. You'll have to make your situation comfortable to make yourself to or make yourself available for the study purpose. So it's your proper planning. So the most important thing, MRCS Part B exam, I always say partner is the most important key to pass MRCS exam. Always remember, don't ever pick a poor partner. Don't ever pick a poor partner, because partner is the most important person that will play in your MRCS play the main role in your whole MRCS journey. Don't ever pick a partner who will leave you in the middle of your journey, like he's in a very family crisis, he is in a very big problem or something else. Problem arises day by day, that's different issue. Emergency is different issue, but don't pick a partner who is not serious, because partner is the most important person that will play the main role to make you pass. So expert partner is very important. So time duration basically varies. I would suggest 5 to 6 months, and 5 to 6 hours continuously would make you, is enough to make you pass. And if you are a full-time reader, or if your job is to only to pass the MRCS exam, I think your only 4 to 5 months is enough to make you pass perfectly. So study materials, all the materials, I always would like to say, all the materials are available in the market or anywhere, or PDF, everything is same. So you may come to know that so many mentors anywhere, so many mentors comes and goes, but everyone's material is the same. Just they do arrange the materials in their own way, but all the content are same. So it's not a big deal. But I think anatomy material should be more enriched, and I will be working on the anatomy especially. What about the cost? You do know what about the cost? Almost that is written on the website, that fluctuates almost 140,000, 1,40,000 in Bangladeshi taka about the cost. But exam cost is not the most important thing, because you will have to have some help of the academy or coaching center, coaching. Then you will have to add the what it say. You have to hands on, then you'll have to plane fare, then you'll have to add staying. Then if you do very well in the exam, then you'll have to add shopping. All these things are included in your exam. As I did very well in my exam, I spent almost 1 lakh taka in Singapore airport with my credit card. So I didn't get even to roam around the Malaysia, because I went there on 10th, and I finished my exam on 14th, and I leave my hotel on 15th. That's why I didn't get any for a single minute. I didn't get to go outside in Malaysia. That's why. Whatever, jokes apart. So this all about the cost, and cost is very vital. So I think 3 to 4 lakhs. That depends on person to person. If you don't go for the shopping, that's different issue. And if you are going through a transit, that's different issue. These things depends on person to person, and where you are going to appear, UK or India or Malaysia or something else. So I do have some plan for you guys, and you already know that I am working on FCPS residency MRCS Part A exam for a very long period of time. And I do have a plan to go to UK as soon as possible. And I do have a plan to start online mock every alternative day. And I do have a plan to focus on the January, I think the 13 to 20 date, who are appearing the exam. I will focus on those candidates mainly, and also all the other candidates are invited to appear in the mock, but I am mainly focusing on them, and I will make a routine for them for the skill from the very beginning, and the knowledge at a time, and every alternative, like for the 7 days, for the 7 days, I will have a plan to make this for the first day for the first mock, third day for the second mock, fifth day for the third mock, and you will have 1 or 2 days in your hand. Then for the 5th day or 7th day, to practice all the mock that we have practiced in the online, in a real time, or in the exam, as an exam, this portion. So I am repeating again, I have a plan to practice 3 times mock session in a week, every alternative day. So after 6 days, I have a plan to book a room anywhere. That might be depends on, that might be on BSMU or anywhere. So that all the candidates come here, and they will practice here in that room. What will be the real scenario? Like, this is the room, and this is the table, and I'll be there, and all the candidates will appear in the mock session. They will sit like this way here, and I will randomly pick one person and will ask to come here, and I will make all the question papers like the exam, and I will start taking the mock as the real time mock, and the examiner, the doctors will answer all the questions, and all the audience will face or enjoy the mock session, so that they will come to know what's really going on in the real stations. So this is my plan. So I have already mentioned that we do have we'll have online mock every alternative day. So we have real-time mock once in a day, and that will be the main role of the mock session, because it will be real-time mock like exam, this portion. So I don't have anything more to say. Just practice is the main key to success. I always say, I already mentioned that I have seen so many persons in my life. They have tried so many times and with a very big amount of dedication, but they couldn't make their same to pass in the exam, because they don't know how to start. They practice but not under the supervision, and they don't know how to prepare, how to approach the patient, how to change the facial expression, how to have their eye contact with the other person, how to note the when to note the head when it is needed, when to look on the patient, and when to write it down. So these things are very important, and you'll have to practice, and you'll have to answer very smart way. You will have to make your professionalism. I have just forget to mention that. Just have a look this portion. This professionalism itself contains 48 marks that they will just observe you, and they will give you 48 marks out of 340 marks. So this thing is really important. So if you don't have enough knowledge this portion, you are losing this total 48 marks. So these things are really important. So is there any suggestion or any advice for me?
Actually, Rifat, your plan is so nice. Actually, I failed in last September in MRCS
Dear friend,
Part B
no problem, no problem. You will pass definitely, inshallah.
session.
I can
So
assure.
I just felt that there is lackings in my skill, and as I am a doctor and I am doing my job, so I cannot uh, take a break from my job. So if you arrange a mock in a week in real time, as a real time, it is so helpful for all of us, because in Bangladesh I already contact so many bhaias, apus, and coachings. They cannot take any real time mock. They only focus on hands-on, but just before exam, the hands-on is not benefited
Yes,
for
that's the
us.
thing I would like to say, my dear friend. And just guys meet with Dr. Kaushik. He is very close to me, and he's my friend from the medical college, and he appeared in the same center with me, and he's very close to me. So Dr. Kaushik is saying that before just finishing the before the starting the real exam, all the so-called mocks going on, but the thing just I think the hands-on should be done. There's I think there shouldn't be any hands-on, right? There should
It's I just want to say this, that
because
there is
still want
no
to develop
thing
initiative.
like hands-on. There is a practice in every week as a real time,
Yes,
like a hands-on.
yes. What really goes on? What really just before a exam, hands-on goes on just 3 to 4 days or 5 days before the exam, and that won't make you pass, because they might make you puzzle rather than make you passing, because you're practicing for the long 6 or 7 months at a time, and just before the exam you the mock mentor just change everything. So that's a very disappointing, and you will be get into a puzzle, and you won't be able to answer anything. So I think there shouldn't be any more, rather you have to practice.
Actually, there is no time to improvising ourselves
Yes,
after
definitely.
completing a hands-on. So if you arrange a real-time mock in every weeks, it will be so much benefited for
Yes,
all of
yes,
us.
doctor. I'm thinking about to make a real-time mock, so that every doctor who wish to come here, and I have a plan. So if as I working as a mentor for long 4 years, and I have almost 10 to 15,000 doctors to whom I have taught physiology, Bailey lab, or something else. But I would like to teach, or I would like to guide in the clinical aspect for a long period of time, and I think is the most important or the high time to start a clinical arrangement. So that's my plan. I would like to arrange a real-time mock after for long 3 days online mock. So all the mocks we'll discuss in the 3 days. All the mocks will be again taken on at the end of the week, and randomly I'll choose someone to come forward and participate in the exam, so in the mock, real-time mock. So I think that will remove all of your fear, and you will be habituated how the exam really goes on, what's really happening in the exam, how to answer, and I will make you sure that that will be really beneficial to you, because I will after finishing your mock, I will solve the solution, I will solve the faults, or I will solve the problems you are facing, I will solve all the wrong steps you have done in your mock. So I think that
Exactly.
is the best opportunity or best way to make you perfect.
Okay, Rifat.
So is there anyone who would
please
like to
arrange
say
as
something?
soon as possible, so it will be helpful.
The total
to take
depends
our
on the participants.
preparation.
This totally depends on participants. Is there is some participants, much more participants than not that much participant, then I would like to arrange in BSc Memo, so that that won't bring much more cost. And if participants more, then I would like to arrange a room anywhere. I give some I found some proposal from some coaching centers, so I will think about that. If participants more, then I will take a room and I will arrange everything like a real-time mock. So you don't have to fight before the exam how the hands-on going on. You don't have to correct just before the exam. Just you will correct yourself from right now.
Okay.
Jyoti would like to say anything. Dr. Sabrina, Dr. Anava, did you get it, sister?
Assalamualaikum bhaiya, Dr. Rifat bhaiya.
Okay,
Would you please save this recorded video in the Telegram group, as many of us couldn't join this meeting from the first.
Okay, okay, brother. In every exam after passing FCPS or passing residency or even passing MRCS Part A exam, I did a recorded version, and I have uploaded in my YouTube channel. I do have a YouTube channel, and the YouTube channel has only 3 or 4 videos. So I would like to also keep the recording on the YouTube channel. Nothing to worry about. I will share the link.
Thank you.
Dr. Jyoti, would you like to share anything, sister? Dr. Jyoti is very close to me. Dr. Nahida, Annava, Russell.
Thank you so much, Bhaiya. I loved your session. There were so many mismatch information that I got beforehand, but everything got cleared. So thank you so much, Bhaiya. I really love the fact that you have discussed about the proper approach and also the real-time environment and the circumstances we actually face that we do not anticipate beforehand. So that was extremely beneficial to us. Thank you so much.
Thank you. Guys, meet Dr. Annava. She is from my FCPS batch and also from MRCS Part A exam, and she has alhamdulillah completed both FCPS and MRCS Part A exam, and she's very close to me. So alhamdulillah, Dr. Annava, thank you very much for your appreciation. Dr. Jyoti, are you there? Do you like to add anything?
ভাইয়া আমার জানুয়ারিতে পরীক্ষা, আপনি কেমনে কি করবেন আমি জানি না, আমাদের পাস করানোর দায়িত্ব আপনার।
সো আমার হাত দিয়ে রেসিডেন্সি পাস করছে, ইনশাআল্লাহ এটা পাস করে যাব। এমআরসিএস পাস।
বুঝছেন, আপনার খারাপ করলে কিন্তু আপনার রক্ষা নাই, আপনার পাস ক্যান্সেল হয়ে যাবে।
ইনশাআল্লাহ আপু, তুমি এত
ভাইয়া,
হ্যাঁ হ্যাঁ
ভাইয়া আমি নাহিদা। যদি আপু জানতে পরীক্ষা দিচ্ছে, আমি কিন্তু যদি আপুর দলে আছি, ঠিক আছে? আমার পরীক্ষার সময় যদি আমি ফেল করি, আপনার কিন্তু পার্ট বি বাতিল।
ইনশাআল্লাহ কোনো সমস্যা নাই, কোনো সমস্যা নেই। আমরা এমন ভাবে প্র্যাকটিস করব যেন ফেলের কোনো অপশন না থাকে। আমার একজন খুব কাছের বড় ভাই আছে, তানভীর ভাইয়া। তানভীর ভাইয়া, আর ইউ দেয়ার? আর ইউ দেয়ার, তানভীর ভাই?
I am on the way from outside Dhaka. I'm hearing you.
Okay. how about the session? Did you get everything, Bhaiya?
Yes, yes.
I know you.
Thanks again. But actually, as I'm in a noisy environment, I can't communicate with.
Thank you.
So I think that will be very much helpful for everybody. And the main thing is that we have to practice.
Practicing is the key, and always practicing is the key under the supervision. And I would always add, practicing is the key to success for MRCS Part B exam and under the supervision. If you are practicing in a wrong way and repeatedly, and that will make your habit, and that will make a very wrong habit, and that will lose some mark. So I always suggest you, practice is the key under a very supervision in a very proper way. Right? Dr. Shojot, are you there, brother? So, is there anyone would like to add anything? I request you to.
Assalamu alaikum.
Sure, Russell.
I just joined few minutes back.
Okay.
Because we have here get together
having
in
the
family,
recording.
so I couldn't hear anything. It will be very helpful if I get the recorded version.
Okay, Rafiuddin Khan, Dr. Rafiuddin Khan, he was asking for the session for a long period of time, and I'm here, especially here for you, Dr. Rafiuddin Khan. Are you there, brother? Okay, I think he is not here. So thank you very much. I will give the mock routine in my group, and that group will be very active from now on. And if you are willing to, and I already mentioned that I'm working as a mentorship for a long period of time, and I have taught physiology, Bailey Lab, and Alhamdulillah, I'm doing very well for a long period of time. If you would like to join the session, and just don't hesitate to knock me or call me, and here is my Telegram number and email. You are free to knock me. Thank you very much. From now on, we'll practice every alternate day, inshallah. I will post the routine here. Okay, thank you very much. Is there anything that you'd like to add? Anyone?
Okay, Rifat, please, as soon as possible, you send in the group all of your course details. Okay.
Yes, inshallah.
Okay.
Inshallah. Okay.
Okay.
Thank you, Bhaiya.
Allah Hafiz. Would you like to say anything, Russell?
No, Bhaiya, thank you. That was a great discussion.
Thank you very much. Okay. Allah Hafiz.
Assalamu alaikum.
So, yeah.
Assalam.